Welcome, Dr. Holland. Thank you so much for joining the Peer Area Chamber as we try to give information to our community so that we can best react and respond to the COVID pandemic. So we'll start with this
Thank
welcome. Could you give us a
you.
quick update on what's going on with the hospital and what
Well,
you guys are
thanks.
seeing there?
Yeah, thanks, Jamie. It's still busy. I tell you, we'd had this conversation several weeks ago now about the surge and COVID and where we're at. And I would just tell you, remind everybody that it's back in March when we started this. It was a whole new thing. I mean, there wasn't a playbook for how we do this necessarily. Now, there are playbooks and certainly plannings for pandemics and surges in patients. So, but we thought we would have, maybe 50, maybe 100 patients with COVID. I mean, we just didn't know. So there was a lot unknown, and we did a lot of planning about where we would put patients. We had shut down our facility in terms of elective things and really outpatient things, everything except urgent and emergent things last spring for a period of time. And part of that was, again, the big unknown. Part of it was the conservation of PPE. Part of it was to protect healthcare staff so that they were ready to work for the hospital and be healthy to take care of sick patients. The good news is South Dakota, we got through most of the spring and summer without a lot of surge in patients. I would say we had a few, pretty much all day, every day through the summer. We had a few patients with COVID that were hospitalized locally, and that went well. It did teach us a lot about COVID. It taught us a lot about how to manage the disease. Starting in about September is when we saw the numbers start to really rise. And I just remember watching the daily census for COVID patients within the Avera health system, really under 100 most of the summer. And then it kind of went above 100 and rose almost exponentially in September, October, and really the first part of November, up to over 300 patients at one point. And I would tell you, it's kind of plateaued now and decreased some over the last 2 weeks or so, or 3 weeks. And so that's been reassuring that maybe we did have a peak. And so right now at St. Mary's, we were up to about 40 some patients at one point, with up to about 20 of those having COVID. The numbers have settled down a bit. And yesterday when I checked in the morning, we had 30 some patients in the hospital. About half of those, or a little less than half, had COVID. And so we're in that 12 to 15 COVID patients at any given time, and probably an equal number of patients that don't have COVID in our hospital at any given time. And I always remind people, remember, we're a hospital that, although we're a licensed 50-bed hospital, I think historically that's where we've been over the last several decades. Medicine has evolved to really an outpatient entity, and people are very familiar with getting surgery and going home the same day. And whereas, a couple decades ago, you might spend a few days in the hospital. So just with that evolution, our census typically is about 15 patients, give or take 5. And so although we have plenty of rooms and beds, having staff available to care for double or triple the normal volume of patients we normally have has been a challenge. And we continue to use clinic staff and other non-hospital staff, people that are working in quality department, people that are working in the business office and other areas, administration, to really augment the hospital staff over the last many weeks. And it's just been incredible to see everybody stepping up, working extra shifts, doing things that they just, maybe some of us haven't done in a long time. But really stepping back into that and helping out in the hospital to take care of our patients, which, as you know, are our own community. So.
Well, you guys certainly have been stepping up and being that true front line for our pandemic here. So, anything else that's challenging or going well? I mean, it sounds like your staff situation is the challenge, but they're really stepping up to the plate. So,
Yeah.
kudos to your team.
Yeah, I would tell you the challenge has been staffing, and then what's going well has been staffing, and it's difficult. It's going well, but I just worry about the longevity of it and how long we can maintain. The duration of this pandemic is going to be a challenge, and that's an ongoing challenge. A few weeks ago, really trying to focus on getting through December with staffing and making sure we had people in shifts to accommodate the number of patients we had, crossing our fingers that the numbers of patients wouldn't continue to escalate. The good news that has leveled off. I just worry that this is going to be a prolonged and protracted event, and staff are already tired and exhausted. And so we're trying to do our best to, pull people out and get them a rest when they need to. It's just, that's our biggest challenge. Some things that are going well for the most part, supplies that were a problem early on in this pandemic or a concern have gotten better. We can get most of the things we need. There's occasional glitches in that supply chain, but for the most part, it's much better than it was early on. So.
All right, well, that's great to hear. I mean, that things are plateauing a little bit. Hopefully that's the trend and your staff can get some respite here.